Movement underlies the physical, biological, social, and individual behavioral roles. This is a part of a series of presentations on the mind stimulation therapy to promote personal well-being by Muhyiddin Ahmed. There are constant movements going on within our internal bodies at the biochemical processes and in the outside physical world at the micro, subatomic, observable, and cosmic macro levels. These constant movements in our micro and macro physical worlds, many of which are predicted with the aid of mathematical models, as Einstein did, or with geological, chemical, and genetic analysis, are becoming increasingly observable with advancement in computerized instruments. The ground that we are standing on and the earth underground, seemingly immobilized, are in fact in constant physical motion. All the animals, people, birds, insects, plants, and microorganisms that are outside of our living bodies and within our bodies are moving individually or in groups. Human history is characterized by conquest and invasions, migrations and immigrations, displacements and settlements, all of which reflect movement as an underlying universal force. Our conscious experience of being alive rests on the awareness of movement within ourselves and on perceiving movements in our immediate social and physical environment. As part of life, we all at various times experience some degree of personal distress and discomfort due to family, social interactions, work, living situations, or what we perceive to be adverse social, political, or environmental related changes. Typically, our personal distress and psychological maladies involve persistent preoccupation with negative thoughts, feelings, and associated behavioral habits that we perceive to be interfering with our everyday functioning. This persistent preoccupation with negative thoughts and feelings in some ways may contribute to our inability to move our thoughts and ideas in our mind to allow us to function productively. Our optimal adaptation to our physical and social environment involves determining how best to navigate our movements and social interactions while respecting self-boundaries and other boundaries for our personal well-being and social functioning. Awareness of movements in and around our living experiences may promote a flexibility of our mind to give us more of a self-control in our ability to move away from persistent maladaptive preoccupations. In our diverse ways, we all practice positive redirection by engaging in various forms of everyday activities, all of which involve moving our thoughts, feelings, and actions in ways that promote personal well-being. Some of the examples of use of positive redirection strategies in our everyday living experiences are social conversation, engagement in various activities such as household chores, work, personal routine, driving, shopping, etc., listening to music, watching TV, reading, or other recreational activities, doing physical activities such as walking, exercising, playing sports, golf, tennis, etc., or practicing in one's religious or spiritual faith to cope with existential uncertainty about the future. Most people across cultures are able to successfully manage experiences of psychological problems without having any negative effects on their everyday functioning by using various positive redirection strategies that I cited. But for some, such distress experiences may become pronounced or persistent, affecting negatively their everyday functions, including sleep, eating, mood, and activities of daily life, interfering with their social and work relations, or in the ability to do their role or age-expected normative behaviors, causing personal and social distress as to their safety and personal well-being. Some of them may need professional help to deal with such persistent psychological problems, causing personal distress, interfering with their daily functions. Professional help may involve psychological or biological intervention or a combination of both, as our mental functions and brain activities are intimately connected and influenced by both interventions. Psychological help in the form of counseling and psychotherapy, involving the usual conversational mode of practice, is intended to provide positive redirection and movements of ideas, thoughts, and feelings, and associated behaviors to promote personal well-being. Similarly, psychiatric medication treatment is intended to provide positive redirection of movements of biochemical events within our body to promote personal well-being. I will talk more in details in my future presentations on the use of positive redirection and use of movement awareness for positive mental health and well-being. This is the second part of series on use of mind stimulation therapy model to promote personal well-being. Please visit my previously posted presentation on movement awareness exercise promoting personal well-being.